Behavioral symptoms are often present years before typical PD motor symptoms, which suggests they are driven by the underlying disease process. The main behavioral manifestations of PD are mood disorders like anxiety and depression that are prevalent in approximately 40 to 50% of PD patients, and sleep disorders like insomnia or alterations in the sleep-wake cycle. Moreover, scientific data has shown that dopamine treatment can help with some of the behavioral symptoms like apathy or anhedonia, but it can also create other ones like impulse control disorder or dependence to the dopaminergic pharmacs. At first, PD was considered a movement disorder without several cognitive implications. We now know that in long-term, cognitive degeneration is present in almost every PD patient. They are commonly treated with cholinesterase inhibitors. Cognitive symptoms are not severe or minimal in the first stages of the disease, and they show up in a serious level years after the start of it. There are dopamine-dependent cognitive symptoms which emerge earlier, like deficits in attention, processing speed, set twitching, and verbal fluency. And on the other hand, there are non-dopamine-dependent ones. They emerge later, like deficits in episodic memory and visuospatial function. The last type of non-motor symptoms are autonomic ones. They don't respond to dopamine treatment. In fact, they are usually worsened by it. The major AS are sexual dysfunction, urinary symptoms, changes in thermoregulation, constipation, incontinence, and orthostatic hypotension. Constipation usually predates motor dysfunctions, while incontinence and orthostatic hypotension tend to become clinically significant at the later stages of the disease.
Created using Powtoon.